The first class that we wanted to talk about, I don't know if we've ever actually mentioned these by names on the show, but we've talked about examples of them in abundance, and these are GPCRs. So, Max, can you take it from here? What exactly are these?
Sure. Well, GPCR stands for G protein coupled receptor. They're also called serpentine receptors. It's kind of a neat name, only because they're composed of seven helices that kind of wind up and down in the cell membrane, and
So,
they're
like a
used for
snake?
like a snake, exactly.
Nice.
I mean, they don't really look like that, but all of the images that are based on the crystal structures kind of look like that, hence the
So,
name.
if you have your crayon box out, start drawing a snake.
Exactly. But they're used for signaling. Um, Essentially, something will bind to the outside of that receptor, outside of the cell, and that causes a reaction within the cell. So it's kind of like a telegram. Someone knocks on the door, hands a telegram to the person delivers the message. So they're not actually entering through the door, they just relay a message. That's called a signal cascade. And GPCRs are very prevalent throughout the body, and they modulate a lot of different biological processes. So, Christine, for instance, did you have a cup of coffee this morning?
I did not. I'm trying to wean myself off of it, but I know plenty of
Okay.
people that did.
Well, I certainly did. And I like a little bit of sugar in my coffee. So the sensation of both bitter and sweet tastes are modulated by GPCRs, as well as other senses like sight and smell. There are also cardiovascular functions and even mood. Certain types of moods, like happiness, are modulated by GPCRs, like serotonin receptors. So they're very prevalent for a variety of biological processes.
So, how exactly are they important to the drug industry?
Well, it might be surprising, but around 30% of prescription drugs currently on the market target a GPCR. So they've been around for a long time, and it's still a very hot area of research. One example is Heptares. This is a GPCR specialist who was recently acquired for around $400 million, and there are a number of companies working in this area. And also, just to put this in context, a crystal structure of the first human, or I should say the first crystal structure of a human GPCR won the Nobel Prize in 2012. And that paper was published in 2007. So, often with the Nobel Prizes, it could take a couple decades, 3 decades, 4 decades to be recognized for work. In this case, it was only 5 years. So GPCRs are incredibly important to the drug industry. They'll continue to be. And there are a lot of prominent examples of drugs that target this class of proteins. Zyprexa from Eli Lilly that treats schizophrenia is one example. You probably heard of Clarinex as well. That's a popular antihistamine made by Merck. And Zantac, made by Boehringer Ingelheim. Those are three prominent examples.
Yeah, to add to that list, because there really are a ton of them, we've got Advair Discus from GlaxoSmithKline, Abilify, OxyContin. There are really a ton of these.